1. The nurse notes blanching coolness and edema at the peripheral intravenous (IV) site. On the basis of these findings, the nurse would implement which action first? 1. Remove the IV. 2. Apply a warm compress. 3. Check for a blood return. 4. Measure the area of infiltration. Which client would the nurse assess first? 1. The client who has a nasogastric tube attached to intermittent suction. 2. The client who needs to receive subcutaneous insulin before breakfast. 3. The client who is 2 days postoperative and is complaining of incisional pain. 4. The client who has a blood glucose level of 50 mg per deciliter, 2.8 mmol/L, and complains of blurred vision. A woman at 32 weeks gestation is brought into the emergency department after an automobile crash. The client is bleeding vaginally and fetal assessment indicates moderate fetal distress. Which action should the nurse take first in an attempt to reduce the stress on the fetus? 1. Start intravenous (IV) fluids at a keep open rate. 2. Set up for an immediate cesarean section delivery. 3. Elevate the head of the bed to a semi-Fowler's position. 4. Administer oxygen via a face mask at 7 to 10 liters per minute. A nurse is auscultating breath sounds in a hospitalized client with emphysema and hears these sounds. Which sound should the nurse document? 1. Crackles. 2. High-pitched wheezes. 3. Bronchial breath sounds. 4. Bronchovesicular breath sounds. The nurse is changing the tapes on a tracheostomy tube. The client coughs and the tube is dislodged. What is the initial nursing action? 1. Call the health care provider to reinsert the tube. 2. Ventilate the client using a manual resuscitation bag and face mask. 3. Cover the tracheostomy site with sterile dressing to prevent infection. 4. Call the respiratory therapy department to reinsert the tracheostomy tube.